I'm Paul Hamilton, I'm an orthopaedic surgeon and I specialise in foot and ankle surgery and I work at Welbeck. Flat feet, which is also known as pes planus or fallen arches, is a common condition where the arch of the foot is absent, causing the entire sole of the foot to come into contact with the ground. This in turn causes overpronation, where the foot rolls inward when walking and running, and can cause a variety of symptoms in the foot and lower legs, and as it increases stresses elsewhere in the lower leg. Patients may also get symptoms of fatigue, instability, and this may affect the gait. There are two main types of flat feet. Physiological flat feet is the most common, which means it's normal for that individual, and sometimes relates to ligament laxity. Pathological flat feet relate to structural abnormalities within the foot. These are sometimes present at birth, and these are called congenital, and these are reasonably uncommon. Acquired pathological flat feet usually come on later in life and can relate to certain conditions, injuries, and occasionally lifestyle factors such as obesity or being overweight. The most common reasons for developing flat feet include aging, where the tendon on the inside of the ankle becomes degenerate and fails, or arthritis develops. Or it can relate to an injury to one of the structures in the foot, which can be either bony, tendon, or ligamentous. Other conditions that can affect the ligaments, such as elastandus, or joints, such as rheumatoid arthritis, or muscles, such as cerebral palsy, can also cause flat feet. It's important to note that flat feet that do not have symptoms do not require treatment, but only those that have pain, discomfort, or activity-related problems that need evaluation and possible treatments. Typically, diagnosing flat feet involves a combination of clinical evaluation, a physical examination, and imaging studies. The clinical evaluation usually involves asking about current symptoms, previous injuries, family histories, and issues with daily activities. Physical examination involves looking at the feet and the lower limb, examining your gait, palpation of the structures in the foot, and the range of movement in the foot and ankle. Imaging studies range from simple X-rays, standing CTs, and occasionally MRI scans, which look at the alignment within the foot and for any structural abnormalities. The aim of the evaluation is to understand the cause to develop a treatment plan suitable for each individual patient. The management of flat feet depend on the cause, the severity of symptoms, as well as patient's age, expectations, and activity levels. Simple footwear with arch supports or insoles, either over-the-counter or custom-made insoles, may be all that's required, and these can often fit in regular shoes and be very effective in relieving symptoms. Physiotherapy can often help strengthen the muscles in the foot and the lower leg and improve gait, balance, and overall foot function. It can also relieve muscle tightness, particularly in the Achilles, which often manifests itself over time. Weight loss and activity modification can minimise symptoms and reduce the stress and load through the foot, and can help significantly. If you have flat feet and are experiencing any symptoms such as pain, discomfort, functional limitations, or a change in the shape of your foot over time, then I would recommend that you seek advice from a medical professional who can help you with the diagnosis and plan management specific to your needs.